Dr. Mao, we are so happy to have you here today with us. My first question would be, you mentioned that your clinical care interest includes kidney transplant, liver transplant, and pancreas transplant surgeries. Like many others, we're familiar with kidney and liver transplants. Would you shine a light on the function of the pancreas and why it would need to be transplanted?
Sure. So pancreas transplant is one of the less common transplants that we perform, and it's typically done for individuals with diabetes, either type 1 or type 2, with complications that aren't well managed with some of the other modalities, such as insulin pumps or glucose monitoring systems. So the pancreas itself is responsible for several functions, but the most common ones we think about is regulating your blood sugar, both high blood sugars with insulin and low blood sugars with the production of a substance called glucagon, something that helps to regulate those low blood sugars. Pancreases also do other functions, including regulation of how we digest our food. With a pancreas transplant, we're looking for individuals that have complications or comorbidities related to diabetes and individuals who aren't well served with other modalities because there are some complications and challenges with pancreas transplant. Each year, people get pancreas transplants to correct diabetes, to correct hypoglycemia or low blood sugars as well, and they do very well. But again, there are some complications for these patients, and the surgery is a more challenging recovery. So it's not for absolutely everyone that has diabetes. Most people that do well are individuals that are, relatively speaking, healthy, younger individuals with good blood pressure, good blood vessels, and overall relatively robust individuals do the best with pancreas transplant.
Most people think that cirrhosis of the liver is caused by alcohol. What are some of the other causes of cirrhosis?
Great question. Liver disease has so many causes. Actually, one of the most common causes of liver disease is metabolic liver disease, meaning obesity-related liver disease. The liver starts out by accumulating fat, typically in individuals that struggle with obesity or overweight, and that fat slowly turns into scarring or progressive fibrosis and ultimately cirrhosis. There are also multiple genetic conditions that can cause liver disease, things such as primary sclerosing cholangitis, PSC, or biliary cirrhosis, PBC, as well as conditions that cause extra cysts on the liver, we call polycystic liver disease. Another common cause is hepatitis C, a virus that we have good treatment for now, but for individuals that don't know they have the virus or did not receive treatment earlier in life, that can cause scarring or cirrhosis. Alcohol, of course, is a common contributor, but there are many, many other things that can lead to liver disease and that could mean that somebody needs a transplant.
Will you explain to us the purpose of hypothermic and normothermic machine?
So we have multiple different ways to support organs as they come to from our donors to our recipients for transplant. Historically speaking, we put organs in a cooler or an ice chest, maybe what you'd take your drink to the beach in, and we brought it from the donor hospital to the recipient hospital. We now know that there are many other ways that we can preserve organs, and that if we preserve organs with some of these tools, that can allow us to transport organs farther, use organs that maybe otherwise would not be appropriate for transplant, and also assess the function of organs before they're used for transplant. Machine perfusion is utilized in almost every organ now. We have normothermic or warm perfusion options for the heart, the kidney, the liver, the lung. We also have hypothermic or cold perfusion options for the liver and the kidneys. And these all are ways that we can better use our donor organs to get more organs to more people in need and help to solve that long waiting list that we're all too familiar with for transplantation.
Share with us how you would like to broaden access to transplantation for all recipients through optimal utilization.
Sure. So our goal as transplant surgeons is to really eliminate our waiting list. Do I think we'll ever get there? I hope not, because I hope that we will continue to allow transplant and give the gift of life to more and more people. But I think what we need to really focus on is using the donors that we have as best we can use them for as many people as possible. So for example, can we support organs getting farther distances? If the right recipient for an organ is beyond what we would geographically go, can we use a machine to help us bring that organ from a faraway place to where that recipient is located? If, for example, an organ may have some minor damage secondary to a medical condition that donor might have had, could we support that organ, give it regenerative cells, for example, and get that organ to the recipient in the best condition that it is possible to get people back to the high quality of life that we're all looking for?
All righty. In our organization, Educating Minorities About Transplants, we have several living kidney donors. I read that you have a special clinical interest in supporting living kidney and liver donors. Why the special interest in this group of people?
Truly, I believe that our living donors are the most incredible heroes that we have. Individuals that are willing to give a part of themselves for the support of another person, to me, is just absolutely incredible. And every time I have the opportunity to work with a living donor, they say to me, I'm so happy I did this, or they thank me for the opportunity to donate. And that's just such an incredible thing that someone is so selfless giving of themselves. The vast majority of our donors live completely normal lives with no restrictions, no challenges upon their sort of paths going forward. We've had donors that have gone on to do incredible feats. They've climbed mountains, chaired the evening news, had children. And it's just really so incredible for me to see how well these patients do. We couldn't do what we do without our amazing living donors. And so being a part of the team that cares for them pre and post surgery, and even years later, if heaven forbid they do have a complication that comes about, being part of that team to ensure that we restore them to optimal health is really an important part of what we do as transplant surgeons.
I know you live a very busy life there at Mayo Clinic. So is there anything else you'd like to share with us before you go?
I'm just really excited about the incredible work that your group is doing. And, our job as transplant surgeons is to give the gift of life to as many people as possible. The more individuals from all of our communities, but really especially our minority communities that come forward as to register to be a potential donor at the time of their passing, to consider living kidney donation, or those that support as a caregiver role, somebody who may need a transplant themselves. It's really a wonderful opportunity, and we look forward to partnering with you and your group and helping to further raise awareness of how we can really support donors and recipients today and always going forward to give the gift of life.
Dr. Mao, I certainly thank you for your time and your participation with us. Of course, Mayo Clinic Jacksonville will always hold a special place in my heart. Once again, thank you and enjoy your day.
Thank you so much. Have a wonderful day, and all my best to you and all of your listeners.